hello everyone. This is RJ Mirchita and I'm again from Radio Mirchi 1310 AM here in the Bay Area. Welcome. First of all, तो I know that मैं विचारता so this is Happy Friday. But you know that COVID awareness program, we don't stop. We continue whether it's Sunday, Saturday, whatever day it is, whatever week it is, whatever time it is. But we are right now here at 9:30 p.m. in San Jose, here in California, and in India we have doctors right with us, and today we actually have a very celeb doctor. You may be wondering what is celeb doctor, but I'll let you guys know more about it. Just give me a second. So as usual, we have Dr. Modha, who is the founder of Gokul group of hospitals from Rajkot, Gujarat, India, and along with him today we have Dr. Sumeet Pawar, and he is our celeb doctor. I know you're a celeb doctor, Mirchita. Why? Well, do you know that he right now works at Lilavati Hospital and Research Center in Mumbai? Of course, Amitabh and all these big celebrities. I think there are so many doctors there. Day in, day out, they'll be like, oh, here is Amitabh. I'll be like, doctor, please, I'm sick, help me, right? They would see them every single day. So we have such a fantastic doctor and marvelous doctor, and I just want to introduce a little bit about him. Whatever I say is gonna be less. બહુ જોઉં શું કહેવું કારણ કે હું always કહું છું કે when I introduce any doctor on this show, it's gonna take me entire book, mini book. There's gonna be a long introduction, but I'll keep it very short and sweet. So he has done his MBBS, DNB, neurosurgery, MBA, MNAMS, FMASS, Japan, FESS, Taiwan. I'm હજી તો full form તો I cannot tell you what is the full form of all this magical abbreviations and all this different titles that he has possessed, but that's a long list. I just want to start very simple. He is right now working as a consultant neurosurgeon and endoscopic spine surgeon at Lilavati Hospital and Research Center. He has specialized in endoscopic and awake spine surgery. મારી આંખો ખુલી ગઈ ભાઈ આ સ્ટેટમેન્ટ વાંચીને. My God, awake spine surgery. That's a big keyword right there. And the key thing is with minimal access tubular spine surgery. That's something incredible. Like, I have never read this kind of thing before, and I'm very, very surprised. With minimal access plus complex spinal fixation. Complex word is itself complex. Ema spine, which is already much more complex, and you have to fix that. Complex spinal fixation and revision surgeries, brain and spinal tumors and spinal trauma. Do you know what is the most scariest thing that I've heard from any person who comes into trauma or who has gone through trauma? It's always about spinal trauma and the fear that the patient may not recover, because if your spinal cord gets destroyed, it may impact your brain and other organs as well. That's the most scariest thing that I've heard. And we have Dr. Sumeet, who specializes, and also Dr. Prakash. Both are like the masters here today on the show. A little bit more on the introduction, which is Dr. Pawar graduated from SET GS Medical College and Chem Hospital Mumbai. He completed his DNB neurosurgery in 2017 from Lilavati Hospital. Again, keywords. Lilavati Hospital, celeb doctors, and Research Center, Mumbai. Not just this, he did his fellowship in minimal access. जो कहती थी ना, बहुत शर्राक थोड़ुक access. Minimal access spine surgery at Southern Tokoku Hospital, Kariyama, Fukushima, Japan in 2018. And he's currently serving as executive member of Neurospinal Surgeons Association of India, which is called NSSA, editor-in-chief for Journal of Spinal Surgery, editor of NSSA newsletter, and he's organizing secretary of Spine 2022 Mumbai. He's also affiliated with world's renowned hospitals. एक तो તમને ખબર જ છે, લીલાવતી હોસ્પિટલ એન્ડ રિસર્ચ સેન્ટર બાંદ્રા, SRCC Children's Hospital, Haji Ali, Bhatia Hospital, Shurusha Hospital, Dadar, Zen Multi-Specialty Hospital, Chembur. And not just this, કહું છું ને, I can publish and write books just on the doctor's introduction. So he has also won numerous awards in research papers, presentations, conferences, and has been a true pioneer scholar of his field of endeavor. And now I would request Dr. Modha to say a few words on Dr. Sumeet Pawar and maybe tell us about COVID statistics worldwide, US, India, Gujarat, Rajkot. So I invite Dr. Prakash Modha.
Good morning, listeners, and welcome Dr. Sumeet Pawar. Sumeet Pawar is a man, is a doctor who do surgery with a very small incision in the spine or in your back, and he do with that endoscope, means very tube-like structure, almost half centimeter to 1 centimeter diameter, and he operates, remove your disc, and makes you all right. So that is what Sumit Pawar is. He was with us in Rajkot also, and we are proud of him having in Rajkot also, and we have enjoyed his company, and we love him like our son, and he's a great man. I wish him great success. And now let me tell the statistics of Corona. In USA, the new cases were 38,285. In India, it is 3,26,123 and death was 3,879. In Brazil, it is 84,486 and death was 2,189. So percentage of death is more in Brazil. And I want to tell you one more thing that about the Australia. See, they have got only 2 cases in the whole big country. Australia has 2 cases only and no death. So we have to learn something with Australia, from Australia, to how to curb the coronavirus in India. So now let me speak about statistic of Gujarat. It is 9,995 cases, new cases, and 104 deaths. Ahmedabad, 2,836 cases. Surat, 850 cases, which has come down drastically. Baroda has increased the cases, 1,068. Rajkot has got 622 cases. Jamnagar has got 393 cases. Junagadh has got 497 and Bhavnagar has got 308 cases. So overall trends are decreasing, patients are improving, but and there are vacant bed in the hospitals, but we need now. What is the problem arising is there those who is version, those who was kept on simple oxygen, these people has version and they need ventilator. So patients are in search of ventilatory bed, and which is not easily available yet in Rajkot. So let us hope that that problem also will solve gradually as the day passes, and we should be able to curtail corona in Gujarat as well as Maharashtra as well as in India as a whole. Sumit, how is the situation in Maharashtra?
Maharashtra is not doing so well. It is still exactly like the situation is in Gujarat. The peripheries are very, very badly affected. Primary reason being the lack of healthcare facilities. Mumbai has improved
Yeah,
significantly.
yeah.
The numbers are quite less. They're in control. It's as simple as you stop the local, and the impact reduces in Mumbai. People can't travel without locals, so that's why they're sitting at home, and I think that has improved a lot for us in Mumbai.
Okay, good. So now I hand over to Ishita. You can ask questions to our beloved Dr. Sumit Pawar, and you discuss about the management of corona and spine surgery. Please, Ishita and Sumit.
Thank you, Dr. Modha. So we were just talking about the cases, right? And you all know that every single day we come here, we give you this literally the numbers. But do you guys know that with COVID, it's not normal for doctors to operate the way they used to operate earlier? Only doctors know that how their life has changed because of COVID, and that too multidimensionally. It's not just at one dimension, right? It's at home with patients, with the care, with the type of dresses they wear, with the hygiene, with the tablets, with prescriptions, with pharma, all these ventilators. It's multidimensionally, it has changed. So my first question to Dr. Sumit Pawar is, how has COVID changed your spine practice, because you are a spine surgeon?
Initially, the practice stopped flatly.
Oh.
Of course, it was a lockdown situation in the early April and just from the mid March. And the practice, we were not seeing any patients, we were not doing any surgeries, so practice literally stopped. Spine comes in the lower in the hierarchy of severity of diseases. Like most of my spine patients are elective spine, so like they have back pain since last 2 3 years, and we didn't know that the lockdown is going to last for so long. So they were like, okay, I have back pain since 3 years, 3 more months. I'll wait for 3 more months. Then I'll go to doctor. So people kept on pooling there and ignoring the symptoms. The bigger problem is over our head, the corona. We have to win it. And so kept on ignoring the problem. And that led to some increase in the severity of the diseases by just sitting on it. Second thing, the corona has changed the way, like you said, the way we dress. We are sitting in scrubs all the time. It's just because we have to take baths so many times. I have to see a patient in COVID ward. I have to go in change scrubs, go take PP, take a bath, and come out. We can't do it in our nice, beautiful suits. We can't do it in with a tie, and we can't waste our time in those things. So we are just wearing scrubs all the time, and it just becomes faster, easier, easy to wash, easy to use, and get done with it. No chance of infection because these are just half sleeves. So I don't want to wear a full sleeves suit and then touch a patient, then carry the infection to next patient. This
Hmm.
ensures that I can assure my hand hygiene much better.
Hmm.
No bling. I used to be very fond of carrying beautiful watches and beautiful pens. Dr. Modha would criticize me about it all the time,
Yes.
but I was very fond of it. Beautiful pens, beautiful watches, and everything, and nothing. You can't do it right now. So the way we look at practice, but few good things have come out of the practice. So for
Mm-hmm.
example, we are focusing more on the video consultations. We have a
Hmm.
separate slot reserved in the day, and believe me, the follow up has improved. When patient knows that he doesn't need to come from, even if it is like 40 kilometers away, if he doesn't
Hmm.
need to come, he's definitely going to visit the doctor. Even in normal times when there was no corona, the follow-up used to be about 80%. So out of 100 patients that are supposed to come to me today, 80 would turn up. That is a normal ratio. And then they would ignore the follow-up. They would come out to 1 year. Yeah, doc, you operated me last year
Hmm.
and I'm doing well. And I'm shocked why you didn't meet me at all. It's a very Indian thing. We don't go
Yeah.
for follow-ups at all. But because of the video consultations, they do come for the follow-up much regularly.
Oh,
And they're
so it's
much more
it's a good
happier.
thing. It's
It
it's
has
a good
improved.
thing.
Absolutely. Not just that, but I have now access to patients from all over the world. My practice
Wow.
in the Middle East has improved a lot because patients are very comfortable doing a. I see all the reports, and
Hmm.
I see the patient in front of me. Some doctor has seen him over there, so I have the clinical notes of the doctor as well. It's not like I'm seeing the patient from. He's not at home and no medical facilities available, so he gets the expert opinion sitting at his home, which is very good thing.
Excellent, excellent. Yeah, and India was not even having this concept of telemedicine. I mean, even in US, we never had this telemed. We had it, but nobody wanted it, right? It- But now it has all changed.
Completely. They want it to be more. We want it to be more cost effective. If you're going there, let us as well show the doctor. Doctor मिलके नहीं आए तो वो खुशी नहीं होता है. And I understand that, but in the given situation, we need to make use of the technology the best possible way. So many apps have come up in which, just like right now, we have made a beautiful collage for all of us. We used to make beautiful collage for our doctors. My assistant would be online, the patient would be online, next patient is waiting to be let in the meeting. and we have made the technology very very awesome. We have not done it, the technology people have done it, and they have made it very very suitable. As soon as the consultation is over, we can send an online consultation paper to the patient's email ID, and this makes it much much more smoother.
Smoother. Excellent, excellent.
Good.
Dr. Modha, any comments?
Very good. Sumit, this is one more new things you have had for the helping the patients. Actually, we are helping the patient. The patient gets benefits, and
Absolutely,
doctor
sir.
also gets benefits,
Yeah.
and both are at win-win situation. You see,
Yes.
so it is easy for doctors also and for the patient not to come to Mumbai from far away,
Yeah.
and he gets his prescription or he gets the advice whether he needs surgery or not on the spot.
Yes.
So this
Yeah.
is very important, and we do have this telemedicine concept here, and we are doing, but not as frequent as it should be.
Hmm.
We
So
are
it
doing
becomes
almost
very
four
nice and
consultation a day, because
so.
people are still not aware that they can approach the doctor by uh, calling them or by telemedicine services.
So the thing is that patient is in Nagpur. He has been told by some surgeon that he needs a surgery.
Mm-hmm.
Now he's not going to come to Mumbai for a second opinion because the traveling, the money, the time is everything is going to take a toll on a patient who's already a patient, right? Even
Yeah.
you would not like to travel 800 kilometers to take a second opinion. So we have saved the cost in that aspect. We have reduced the video consultation fees significantly. We take only about half the consultation fees. It becomes very much easier for everyone that way. So the person, any patient, I always believe in second opinions. Every patient of mine also, I tell them that please take a second opinion. You have a
Hmm.
right to take a second opinion, and you should take it. Just always better that you are double sure of what you're doing. The person and the patient is much more convinced in his mind that I have been advised the right thing and not an undue unnecessary surgery. So this has become much more easier, the second opinions.
Absolutely. And I think the way right now we are collaborating is because of, I think, this technology, right? I am in San Jose, you are in Mumbai, Dr. Modha is at Rajkot, and such a beautiful live
Exactly.
show. So with this, I think let's move on to our next question, which is impact of COVID-19 on spinal diseases.
Oh, it has impacted a lot. The sitting down. So two things are there. One is that we are at home. Second is that we are working from home. So everything has changed. Now, it was not so easy in Indian households to have a workstation, a table and a chair, and then they were working from there. They would be sitting on the sofa. Initially, they all thought that it's a matter of a month, a week.
Yeah.
Modi ji ne bola hai 2 more weeks. Modi ji ne bola hai 10 more days. So we will do it. We'll do it. And at the end of it, what happens is that they, for months together, they are sitting on a sofa and constantly being on laptop, a very very abnormal posture. And I got a very sharp increase in the number of patients between 20 and 40 years of age group.
Oh.
My all my patients usually are 50 plus because they have a degenerative spine problems, like age related spine, back pain, this and that. Now between 20 and 40 patients are coming a lot with neck pain, with back pain. It's a purely mechanical pain because of poor posture and everything. And so we issued a guidelines in June about how to cope up with stuff and how to sit and everything while you are working from home. So we wrote a blog about it. We popularly made it very very popular, shared on all the social media, and I think it had a very good impact. People are not trained to work from home in India. This has helped them a lot. People who were sitting with the spinal problems and their problems got ignored, they chose not to look at it because, of course, there were bigger problems in front of them. The walking stopped, the exercising stopped, the
Um,
gym stopped. Normal person has to walk, and
yes.
not all of us are blessed with the big big houses where they can take a stroll in the house. And in Mumbai, we have houses which is just 1 BHK and just one studio apartments. It's so difficult for people to take a walk and everything, trying to take care of the spine and health in general. So not only the coronary artery diseases have increased, but the spinal problem along with that have increased significantly. And believe me, it is not that it's not possible. A simple, I keep on insisting, a simple Surya Namaskar
Uh-huh.
does not take more than 6 feet by 2 feet of your space, just like your bed. And that is enough for you to keep your entire body from head to toe healthy.
Oh,
Correct, correct.
What do you say, Dr. Moda? What do you say?
Yes, I agree. And Surya Namaskar gives all exercise to all muscles of the body. So that's why you don't get acute spine problem related to posture
nice.
and all. No muscular pain. All muscular pain will go, and you remain fit.
Absolutely. So it's in our mind that we have made a block that no, I don't have a place in my house. Government has stopped me from walking outside. Government has stopped my gym. Boss, you are a gym in your own self. You need to use it to your benefit. So you don't need push-ups or pull-ups or abs and everything. You don't require any weights. You don't need a gym. You just need to do it on your own.
Excellent. Yeah, a lot of people, even I was under that mindset, when my trainer, I stopped my gym here, and my trainer was like, "Why are you not showing up for the gym? Like, how can I do? I have space constraint and blah blah blah." And he was like, You're gonna start the online classes." So we decided after a month that we are gonna do the online gym. And then I used to complain like, "Oh, I can't do my movement," and so I do movement classes. So it's more focused on movement. And I used to be like, "Oh, I can't do freestyle. I can't do this." And he's like, "You need to train your body and mind to adjust in whatever space you have and do it." And then we started using the wall. We made the wall as our movement support system, and we considered just moving around the wall in itself. So
That's a,
headstands, handstands, all these things, we now do it just with the support of the wall.
that is excellent. That is really, really nice thing that I've told. Aerobics and movement movement, these kind of things are very, very essential to keep your spine flexible. So at an older age, you need stability. At a younger age, you need flexibility. Both at the right time are very, very essential. And this movement classes that you're taking is going to take care of your spine absolutely. I don't think you will require anything till you're quite old if you're taking care of the flexibility part. Any aerobics, yoga, movement, it's all same thing, keeping
Yes.
the spine flexible.
So I know that you do a lot of surgeries, and do you want me to share some pictures of the surgeries you have been doing, or should we move to the next question?
Yes, one or two cases I can share over here. The impact, some things cannot change, right? Like I operate pediatric neurosurgery also. These kids need to be operated between 6 months to 8 months of age if they are closed meningomyelocele, and I operate some open one of them, open ones if they are emergency just born. Now, these kids are not going to take a plan when they're going to be born, what the situation is going to be in the country. They have what they have, and they need to be operated at any cost. So, this is one very, very small 6-month-old baby
Mm-hmm.
with a, you can see the my finger, and you can see a black dermal sinus, a dark colored dermal sinus in his upper part of the back. This sinus is going inside and connected to the spinal cord. So this is what we call the thoracic limited dorsal myeloschisis. It's a
Mm-hmm.
very, very small subset of a bigger, broader term called spinal dysraphisms, which is a congenital developmental problem of the spine. And this baby, we did a test for him for surgery at 5.5 months. He came positive for
Oh,
COVID.
oh.
The parents were negative. The kid is positive. So we still has some time available. So we made him wait for 14 days. And immediately after
Uh-huh.
14 days, once the situation was better, the and second COVID test came negative. We took him up for surgery and we operated him. He is absolutely normal, having very good movement of the legs, very good
Mhm.
control, whatever he can have for the urine stream and the potty control. Everything is very, very good, as much a 6-month-old should have. So this is something that Corona has given to us. We are delaying the surgery slightly, but not too much. We still can take control of it. The brain tumors, we have had so many brain tumors in the last 1 year. I work in SRCC Children's Hospital, and this kid came with an what image you can see over here. It's one of the rarest of the rare case of a, I will, it's a very complicated name of a dandy walker malformation with an occipital encephalocele.
Oh my God.
Yeah, it's hardly 32 cases in the world have been reported before this. This is the 33rd case.
Oh my God. So it's
Yeah,
it's
yeah.
even very rare in the world, and you operated on this case.
Yes, yes, yes. And everyone in Aurangabad, for whatever reasons, I'm not saying that it's something to share the blame or something like that, but for whatever reasons, nobody was ready to operate this baby. Nobody. And this baby is now 2 day old, 3 day old, old. Every day is passing by. The sac that you can see behind, that is
Yes.
hanging out, the pouch, the
Yes.
skin was extremely brittle. The water that you can see, the black color is the water. The water had started leaking from there, and Dr. Moda can support me over here. It's an extremely dangerous
Yes,
situation for this encephaloceles to leak. If
definitely.
the infection goes inside, the
They
kid will
do
have a,
get
yeah,
infected easily.
yeah, and they have a
Once
very,
it
very
is
high chance of dying.
infected, it is difficult to treat.
Yeah. And on seventh day, this kid came to us and we operated him. And in 2 days, he was home, absolutely fine. I keep on getting his photographs on every Eid and Bakri Eid, and every single time I keep on getting photographs. Very, very beautiful girl. Very, very, very normal. So far, so good.
Excellent. Excellent. I mean, this.
Excellent. Well,
Mhm.
good, well done.
Thank you. Thank you so
Yes.
much.
And a lot of patients also fear, right, that they should not contact their kids, or they should not come to the hospital because of COVID, right? So uh, that as you are sharing your experience, that would help patients to understand that that is not right if they feel that way, right?
Absolutely, absolutely. So I always keep on saying that don't go out just for some stupid reason. But if it is a health related reason, if you have to weigh the risk is to benefit ratio. If the risk of not going is higher than the benefit of going over there, then I can understand. But if the benefit is more of seeking early treatment, you can always take the risk. So when you're going out on the road, you always can have an accident, right? That doesn't mean you don't go out on the road. So it has to be risk to benefit ratio. You delay this kind of cases, you don't operate them for whatever reasons in a doctor's mind or the hospital or the parent's mind, and you take it on your body, the body is going to give it back much, much, much stronger way.
So
So
Definitely.
we. Mhm.
cosmetic surgery, I can understand. You got a lip job, a nose job. Please take it easy. Do it for the latest. It's you can take it easy about that part. But something that is like about the heart, coronary artery disease, like last talk we had, I saw the talk. It was very interesting. So the coronary artery diseases, the brain, the spine, you cannot take it easy. Is what I feel. Any acute thing, your appendicitis, if it ruptures, you're going to be in big problem. Whereas
Oh.
if you go early in the time, doctor can just do an laparoscopic surgery and remove it. And if you ignore it, it ruptures, and it is going to be a catastrophic surgery, very, very big surgery, and a very big uh, burden on the body. So don't delay treatment. Use your discretion, best judgment to see when you need to see a doctor. Take a second opinion on the phone. It's okay.
So I think we have one question from our viewers or who are watching us live, and I think I'd like to flash that. It's from Manjari Thanki, and she's asking us live here on the show that my husband has problem in L3, L4, L5, and S1 level. Dr. Modha knows the history. He is scared of surgery, particularly in COVID times. He is in terrible pain, but managing with painkiller. What do you suggest? He should wait or think of immediate surgery?
Yeah. Dr. Moda, can I open on this case?
Actually, it's a long duration history. He had a lumbar canal stenosis, severe pain. I advised surgery almost 1 year ago. Then he decided he saw second opinion, Karthik's opinion, some other orthopedic opinion, and then they says that there is no big problem. Let us wait. I said
Hmm.
you need surgery, but as second opinion has arisen, so if they says wait, let us wait. Nothing goes. See, why should we take him immediately? But this was advised surgery about 1 year before.
Hmm.
So now again he is in terrible pain. But I said, little wait. If the corona goes little, 10-15 days now it is. So I will operate him if he agrees.
So
But at
about
that
these
time he
cases,
ran away. because of the scare of the operation, and other doctors advised, "Okay, wait, wait." So he was thinking that it is better to wait rather than going for surgery. So I said, I don't mind, no problem. Whenever you feel problem, you come to us. So actually he needs surgery, but
Hmm.
I said, let this thing goes around this time, or both hospitals are going full. There is
Hmm.
COVID and non-COVID hospitals. Our this thing Vidyanagar hospital is COVID hospital,
Mm-hmm.
and Koalwar or Gokul is non-COVID hospital. So both are overloaded, and he is my cousin. Actually, he is my cousin. So I
Mm-hmm.
said, wait for a while, and we'll sort it out.
So
So
about
if
the
he is
spine,
in,
usually there should not be any confusion about when to operate, when not to operate. We have a very, very clear-cut guidelines based on which Dr. Modha has advised for surgery. But what happens that if you are having pain, Dr. Modha has given you medicines, you are not improving, then we don't have an option but to go to the next step, correct? So you take medicines for usually we give for 6 weeks or 3 months at the most,
Hmm.
and in spite of 3 months of medication you are failing to achieve relief with medicines, then we have to step down your medicine. We can't keep on giving you very, very strong medicine like NSAIDs and painkillers for long duration. They can have an adverse impact on your kidneys. So once you have given this medicine and you're still having no relief, then next step has to be to intervene and to remove the compression. So
actually he
Dr.
did
Morais,
IDSS, and I advised this 1 year back. But at that time, he says, "Oh, let us take Karthik." Karthik also is his relative.
Oh,
So
so
Karthik
usually
said,
the
"Wait,
best doctor is the one who says no surgery
yeah."
for all patients.
is
See,
that
we have
a
been trained.
myth?
Sumit. We have been trained in a way, and we are aggressive in management. But the people over here, they say, wait and watch once." And there is also reason, because the public over here are
Hmm.
too much sensitive, and they blame doctors. If something goes wrong,
Goes
they
wrong.
blame doctors.
No,
So
this I'm
that is
speaking of the
why,
patient's mindset.
because they were
Every
telling
patient
me
thinks,
that wait and watch.
Yes.
And when
So,
patient says from his mouth that operate me, then they will operate.
so that's what I want to know, that why the patient is first of all scared, and second thing, why the patient thinks that the best doctor is somebody who would tell me no, don't go for surgery. Why
so
is that happening in our culture?
I would say the reason is if you I was in Japan and I was very shocked to see the kind of practice over there. My
Mm-hmm.
boss, my guide, would sit in the OPD and he would tell ki, okay, I've seen your reports, everything, this report, that report, and I think you need a surgery. And the lady would ask him, okay, sir, when are you available for the surgery?
Mm-hmm.
There was no discussion beyond this point. In India, the discussion is so सर्जरी लग से सूटकेस वो डॉक्टर तो बोला था ऐसे ही गोली से हो जाएगा अरे डॉक्टर सर्जरी बोलता है
And
सो
that's
आर
the problem.
exactly
Sumit
it's
says
very, very
surgery,
different.
then they will go to three, four other doctors.
Exactly. The reason
And
I
then
would say
what is the
is
problem?
that I think we are much behind in the spinal surgery spectrum as compared to the Western and the Far Eastern countries. So there, the surgery is totally awake. The surgery is totally minimal invasive. So,
Oh,
like, if some doctor tells you that you need a cataract surgery, you don't discuss ki how can he tell me cataract because you can't see, right? And you
yeah.
have to get operated. It's a daycare surgery. You go in the morning, you know you will go home at 2 p.m. or 4 p.m. At home. Barabar. And you have to
Hmm.
take a standard care. In
Hmm.
India, the spine surgery is not standardized. For the same
Oh.
problem, one doctor will say that, like Dr. Moda said, he requires IDSS. Second doctor will say no surgery. Third doctor will say you need screw fixation. Fourth will say, Arey, you're mad or what? Just take my injections, spine injections, you'll be absolutely fine. And fifth, a physiotherapist will come in and say something else only. So there is no standardization of spine surgery. One patient who must have had a bad experience with one of the five and he worsens, he will dissuade thousands of patients like don't go for surgery. I used to walk before, now I can't walk. I used to be
Oh.
this before, now I can't. And that one patient who has failed will keep on having a negative impact on the spine surgery. So you don't choose a bypass surgery, I need or not. You don't choose a brain tumor surgery, but spine surgery and knee replacements. I think doctors are to be blamed over here to a certain extent because we have been overzealous about our patient selection, but there is no standardization, so people are rightfully scared of it. And that's why
I
we
see.
have this habit of we share the number of our previous patients, we maintain a logbook, we take the permission, and we share the number of the patient in a diary outside my OPD. When they are waiting over there, they can take the number of any patient and they can
Hmm.
call the patient and ask the, it's like Amazon reviews, boss. Live reviews. If you have reviews only, then you can have a good experience.
Sumit, I have learned from these all sort of things that
Huh.
we should have a standardization for the spine surgery. You must
Hmm.
fix
Absolutely,
the
sir.
standard. I think we'll involve you. I will fix at the Gujarat level and will invite you to have a this unit surgery. So that sort
Maybe.
of a thing which I want to do. See, we are facing this problem, and he's my cousin. He and Karthik also his relatives, but Karthik is not that. He says no. You wait. You don't have that symptoms. So because I have
Yeah.
seen the lots of people, thousands of people,
Yeah.
patient I have seen, but one person say wait. So to confirm it, he sent to the orthopedic spine
Yes.
surgeon. You understand?
And
So
problem
I.
is, a
then the
problem is,
confusion starts.
Mirchita, if you
Because
observe,
people says wait, so it's better to wait.
Mirchita, if
See,
you will observe,
that sort of a
people have
thing
very, very
happens
high
here.
threshold for suffering in India.
Yeah,
Uh-huh.
he suffers. See what
Correct, sir?
happened. Hello, you see, Sumit, more
Uh-huh.
you intelligent, more you suffer because you take
Yeah.
multiple opinions. If you trust one person, if you go with a one doctor, you will
Hmm.
never suffer. You will never repent because doctors are there. They never wants to harm you,
Yeah.
or neither they are interested to earn. Yes, all doctor needs money.
Hmm.
Everybody, but they will opine you in a proper way. And after this much experience of 35 years, almost 40 years, you can say, but still they go to the another person
Hmm.
who don't have that experience, but he says oh well we'll say well. So this
Yeah.
is the thing.
Maybe.
In India you should
Huh.
not force the person to undergo surgery
Hmm.
because then they will blame you.
Hmm.
In Jayesh we have operated him again. First he was operated for C1C2. I
Oh.
almost
Oh.
15 years back I have operated him. And me and Karthik at that time, Karthik was with us. So me and Karthik were operated together. Him for C1C2 compression, and he's fine now. At that time also he had a little problem of this
Hmm.
thing, but says I said we'll tackle it later. Then it goes on for so many years. You
So,
know,
Dr. Modha and Dr. Sumit, I'm very curious to like, a little shocked also that there's no standardized procedure. So there must be, like an organization level, a way where all doctors come together and they put a checklist that okay, if you have these many symptoms, um, then these are the protocols or this is a standard thing you should follow,
So
regardless of
there are
whatever
guidelines.
experience.
There are guidelines that are issued, but there is no standardized protocol. That like SOP is not there for spine.
Hmm.
Like significantly, you have it in US is what I feel. So if you have a back pain in San Jose or you have a back pain in Houston,
Yeah.
your treatment will be almost absolutely same.
Same.
Maybe the way of operating will be different. Some may use tubes, some use endoscope, some use microscope, some use open. That's fine. It doesn't make a big difference.
Hmm.
But the end point is same. Fixation or no fixation, there is a fixed rule about it. And there's no two thoughts about these things. In India, it's very variable. Second thing, what I was about to say at that time was that Indians have a very, very high threshold for pain. They have a very
Ah.
high tendency for suffering. I had
they
one
go on
young
lingering,
sir,
and they
24-year-old male. I had 24-year-old male, sir, Dukan wala banda. And they came, one of the relatives of my patient, they dragged him to me. Huge guy. And like, sir, इस 2 महीने से बेड पे सो रहा है. And I'm
Mm-hmm.
like, क्यों सो रहा है? 24-year-old male, why is he sleeping at home? Just doing nothing. Because he has got very severe pain. Where is the pain? In the back. MRI. Massive compressions. For some reason, at 24 years, he has got 4-level compression. I'm like, how do you accept that sleeping at home is going to cure you? And just sleeping doing nothing. He's going to have heart issues, he's going to have leg issues, DVT, everything. Nothing, just sleeping at home.
Man.
No, kuch to dekhte. And I told him, ki, okay, I'll help you one way. Don't come what may, don't get operated with me. Now
Yeah,
take my opinion. Please get operated. Go to anyone. So it's not like mera fayda nahi. You have paid my consultation fees. I am happy with that money. Now go to someone and get operated, but get operated. Of course, it did come to me only because, but you have to remove the my fayda from that, and people tend to believe it more. It's actually a
Yeah.
very dispassionate opinion, is what I feel.
And I think after hearing our discussion, Manjri Thanki has posted one more comment that actually he was operated in the past for cervical comprehensive myelopathy,
compressive myelopathy.
myopathy in the year 2004-5. He therefore decided not to open spinal cord once again, and with medication of it, if it works, why go for surgery?
100%. If the medication is working for you,
Uh-huh.
don't take any surgery. Only and only indication for surgery is failed conservative therapy. If the medicines are not working, if the medicines are not suitable for you, if you're not able to tolerate the medicines, or the medicines are causing a kidney damage to you, only in
Hmm.
these condition, or if you have a foot drop, like a weakness, you
Hmm.
have a loss of urine control, neuropathy.
Hmm.
So, a focal neurological deficit, unbearable pain in spite of medication.
Hmm.
Only these are the indication for surgery. If you cannot walk even for 5 minutes, and believe me, if you are okay with that, we are okay with that.
Yeah, he had a severe spasm, not able
Oh.
to bend forward.
Oh.
Spine were very straight, but there was no neurological deficit at that
Hmm.
time.
Hmm.
Still, I advise you need surgery because on MRI there was
Hmm.
a severe stenosis at
Oh.
multiple level, 3 level. But as the difference of opinion came, we
Hmm.
decided to wait for him. And again, he started having severe pain, not able to go to work. So now I said, wait for a while. We'll just things will get clear. We'll operate him.
So, spine surgery is one very unique field. Like, you have to ask us for surgery.
Hmm.
I will tell you solution. That see, medicines are not working. You need surgery.
Hmm.
When to do the surgery, patient has to tell me. You choose. You are suffering. It's your pain. You tell us if you want the suffering to be zero, you want the suffering to reduce, you want us to try something for you. We have an option surgery. When to do is only your choice. I cannot force you for surgery, like Dr. Modha said. It's your choice. If you are happy with medicines, please take medicines.
So on this topic only, I have a follow up question. I know we are running a little bit out of time, but I think it's important to ask that a lot of patients think that I can do surgery after 5 years. But as Dr. Modha was saying, if you don't operate now, let's say in next 2 years, your condition may be deteriorating. You just are not aware of it. So your MRI that you do in, let's say, 2014 versus the MRI you do it now, and if you will see a significant difference, you may be able to walk, but there may be a possibility that after, like, say, 10 years, suddenly you will not walk, or suddenly you will lose your entire spine. You never know. That is that a possibility, or it totally depends on case to case, or
So
case
it
by
depends
case?
on case to case, case to case.
Mhm.
So like cervical myelopathy, like what Dr. Moda has operated him for, it had to be done at the earliest. You cannot delay that at any cost. If you
Hmm.
delay it, you're going to have a continuous advancement of symptoms, which after a point will become irreversible, whether you get operated or not. And
Hmm.
our job is to tell you about and
Yes.
intimate you about the possibility of what's going wrong. Otherwise, patients will say कि अरे हमको बताया नहीं, हमको पहले
Hmm.
बोलते हम लोग पहले ही कर लेते.
पहले कर लेते,
It
yeah.
always happens. It always happens. The hindsight is 2020. So, but our job is only to warn. We can. That's all we can do. So the upper cervical typically,
Mm-hmm.
uh, usually you should do it as early as possible to avoid a long-term, permanent, debilitating advance of the symptoms. Lumbar spine is more of a symptomatic. It's like you will like exactly what Sir said. He cannot go to work and everything. So the work is hampered. Uh, the chance of getting foot drop and bladder bowel involvement is quite remote. Very, very, very single digit number percentage of patients will get that. But if it does happen, you have to get operated without discussion immediately.
Thank you both, doctors. This was a very productive discussion. I think even the listeners are more
Yeah,
interested, and we already got a comment live. Thank you, Dr. Modha and team, for all these answers. But let's move on to the next question, which is, what measures have you taken to improve your surgeries to make it COVID-19 safe?
Yeah, we had to do a lot of modifications for the surgical protocols. Earlier, we used to do only triple H, HIV, HBsAg, HCV for admitting patients inside and operating. Now we have to do COVID also at the same time. We do an HRCT chest also to see if there is any underlying COVID disease. It's not that we don't operate them, but then we have to be much, much more careful when we operate. All of us are doing PPE suits and everything. Second is I have tried to shift my entire practice to a daycare surgery. The less time patient spends in the hospital with too many people, the better it is for the patient. Correct. So if you are going to stay in the hospital for 5 days, you will have three shift of nurses, three shift of housekeeping staff, doctors who are visiting, RMOs who are visiting, into five. So the more people you're getting exposed to, how much ever you're wearing your mask, when you're in the bed, you're going to lower your mask. It's a human tendency. And because of that, we want to keep them in the hospital for the least possible time. So we have shifted from almost all surgeries to daycare surgeries, almost all spine surgeries to minimal access surgeries. Operate from the tube, send him home next morning or same evening,
Wow.
as per the, yes, absolutely. Which we were not very fastidious about before, but now we just push them out of the hospital immediately. We are on the phone, talk to us on the phone, whatever you require, nothing else is required. That's it. All our cost has gone up for the surgery slightly because all the drapes that we are using, we have made it completely, absolutely disposable only. We have
Hmm.
no idea how corona is spreading and what is happening and what we are dealing with. Every day, the CDC is coming out with new information about disease. It's airborne, it's this, it's that, fomites. We have no idea. We are using completely everything disposable, making it
Uh-huh.
very, very safe for patient and for us, for the next patient also.
Hmm.
So that takes care of many, many things that are unknown. We are not giving patient anything, we're not taking anything. It's a bit safer things. So minimal access surgery, only the surgery that are required, and maximum we are doing the video consultation follow-ups. So it becomes a bit easier for patients. We are taking even the sutures that we're taking, we are not taking the staples and the normal
Oh,
sutures that we used to take. We are taking absorbable sutures, so patient does not need to come for
come
follow-up
back.
stitches. Yeah, yeah.
And you won't believe, sir. Today I was just reading the news here in San Jose in US. We just got to know from CDC that nobody has to wear mask anymore, and I was like, wait, did you guys just say that no mask? So now in US everybody can be free, mask free. And we already are seeing cases coming from India with the new variant. And now we question our leadership as on like, wait, why are these doctors saying this? It's quite contradicting. They keep on changing the guidelines. And who is going to check CDC website every 2 hours? I mean,
Yeah,
I won't check either.
correct. It's very,
So,
very difficult. It's evolving situation. We don't know the virus as well as we should be knowing it, and I think we'll just take some more time to understand it.
Dr. Modha,
Yes,
any
very good,
comments?
Sumit. Very good. I agree with Sumit totally. And let us proceed for the next question as we are getting a
Yes,
bit late.
late. So this is our last question, listeners. And if you have any such questions, then you can let us know. But I think we are going to wrap up pretty fast. But Manjri Thanki has just said thank you for your guidance, both of you. So I just want to flash that. But our last question is for both our doctors. Any special interesting COVID cases during these times that you want to share?
Yes. One case that can you please share the video over here? This is a very, very young 24-year-old guy who is from Basti, UP. He met with an accident over there. Unfortunately, very, very high speed trauma. If you can see it over here, I advise viewers discretion when they see this video.
And share it from the
Are you able to see my screen?
I can see your
screen,
screen.
yes.
Yeah, you
But
can play
video
it.
is at the end, so start from the beginning.
Yeah, sure. Let me start from beginning.
This is a very night time, very peaceful time. We cannot see the video.
Uh, Hold on. Let me share again. Um, I'll share this. Let me know if you can see my screen first of all, and then I'll play
Yeah,
it.
now we can see your screen.
Okay, so now
Yes.
I'm playing this video, which is from the another angle, the second video.
Yeah.
Mhm.
You play, probably it will start from the first beginning.
No, we cannot see. Just a static screen only.
Yeah.
Okay, it is playing though. Maybe it's a
No,
little
Somehow,
slow.
we are not able to see.
Okay. Let me
very, very high impact two-wheeler injury.
Mm-hmm.
Till you're trying to play, I'll speak about that. See,
Yeah,
because of
sure,
the
sure.
lockdown, only the most essential vehicles are coming out on the road. Everybody is coming out. Most of the people are coming out for some very urgent work. In that
You
situation, the
click over in the
bikers,
center.
yeah, in that case, the bikers are, I think, not following the road safety rules so efficiently, nor are the four wheelers. Everybody is at very, very high speed because the roads are empty, and any sudden entry of the pedestrians or the bikes, people are not able to control their speed. Our Indian cars are not that good that they are going to have a perfect, yeah, like 60 to 0 in 3 seconds and that kind of tire. They look very good in advertisements. Our cars are not made for that. And if you could see the video, you would see a very, very high impact injury. Yeah, now we can see the video. Now we can see the video,
Okay, so
Mirchita.
you can see, right? So
Yeah,
this is
now,
the video I'm playing.
yeah. You can see the yellow guy in discussion over there, the biker, and a car has just dashed him. He has just vanished. We cannot see him anymore in the video. Yeah. This is the second time we're playing the video. This car is coming in high speed and just dashed the guy completely. Yeah. Mirchita, can you show the second video?
Yes, I am just trying to add the video file. Give me a
Uh-huh.
second.
He had a major accident. They noted that he cannot move his legs. Yes, you see this video, this angle.
Mm-hmm.
Yeah. And we can see he is just flung off the bike out of control. Almost 20, 30 feet he has been thrown off.
Here.
Yeah. And the person who was driving the bike, he got up and he sat again. But this guy who was sitting behind is not moving at all. He's a very, very healthy young 24-year-old male who met with an accident. Maybe he was coming from a function and he had this accident. Okay, after that, he went to all the major hospitals in the vicinity. He went to Delhi for treatment. He was admitted in one of the most prestigious hospitals in Delhi for spine surgery. They did his COVID test. His COVID came positive. They sent him home. They said, we cannot operate a COVID positive patient at a hospital, and they sent him home. And after that, the patient has been contacting everyone around India for any medical support. One of my patients gave my number to him, and they wanted to come to Mumbai for treatment. I checked with my hospital, Lilavati, they had COVID bed available, and I told him that please take due care, responsibility, e-pass of getting a COVID patient from UP to Maharashtra. They arranged a special COVID ambulance. They got an e-pass and they came over here. After coming, we settled him immediately for COVID part as well as the spinal part. And we operated him yesterday under full due precautions, the complete COVID setup and everything. And we did neuro monitoring also, which tells me whether the cord is intact or not. Can you show that X-ray, the
Yes.
photograph of the 3D
Yes.
reconstruction of the CT scan?
Mm-hmm. Let me share the
Meanwhile,
screen.
Sumit, let me ask you, was it paraplegic or he was able to move little? Both legs.
Completely paraplegic, sir. Dense paraplegia.
Can you see the screen?
Yeah, yeah. If you can zoom in that area, I have numbered the vertebrae. So that's the first, second, and third dorsal vertebra.
Mm-hmm.
And then behind you can see is the D4. Behind that, the vertebrae are aligned one below the other. This is such a high grade impact that the vertebra has slipped and has come in front of the other vertebra.
Oh.
Luckily for him, the posterior elements of the spine had broken. And so the cord was still intact. The cord did not get completely cut, but because the bones were shattered from behind, the cord
Mm.
was still continuity. and the bones broke. So when we did electro monitoring, we did an electrophysiological monitoring. The brain was sending a current to the legs, and that is all I required to do the surgery. It means the cord has not been cut in half, and
Mm-hmm.
whatever I do may have some impact in his future. Right now, he could not even sit. He had bed sores and everything. So we're treating him for everything. If you can show the fixation image,
Yeah.
the
Is
image of the
this the
X-ray.
one?
Yeah, yeah. We have done a massive fixation for him. We have decompressed the from D1 to D4. This is a completely open surgery, by the way. We don't do
Oh
minimal
wow.
access, and we should not be doing minimal access and endoscopic surgery in a trauma,
In this
tumor,
case, is
tuberculosis,
out of it.
infections. Yeah, and an excellent fixation has been done. We are hoping that he will regain the moment very soon. He's right now recovering, and it's all both things. COVID is there plus the illness, so he will take some time, his own sweet time. But we are hopeful.
Yeah.
What we need to
Good.
remember: the kid came 1800 kilometers from Basti to Mumbai to seek
Oh.
treatment for a relatively, I would say, simple spinal fixation. This should not have
Did he
happened.
improve post-operatively, Sumit?
Nothing right now, sir. The
So far, nothing.
electrophysiological signals, SSCPs improved after surgery. 50% improvement was there.
Yeah, very good, very good.
But the clinical improvement, yeah, we are yet to see the
It
clinical
will take
improvement.
time. It will take time.
It will take time. Yes, yes. Very
But
hopeful, sir.
Correct.
but
And praying
that
for the kid.
that video itself was first of all very scary. Both the
Very
angles,
disturbing.
the bike flung somewhere, right? And then the images you shared of this X-rays and all the his pictures, right? That itself of the spine image was scary. It's like can't imagine. And then still the spinal cord was intact, which is like a good sign, and you decided
Very,
to
very good sign.
operate. And just tell us about that. How many doctors rejected this particular patient, and then it came to you?
I would not like to harp on that point about how many doctors rejected, but
Uh-huh.
all I would like to say is that see,
Yeah.
this is all a purely COVID related injury.
Uh-huh.
Roads were empty, he was driving in the middle of the road, car was very, very fast, so
Hmm.
the accident happened. Maybe it would not have happened had there been a traffic. It is a main road of the city. Main traffic होता था तो उतना fast कोई नहीं चलाता था. Possibly. Then he had a 14 days delay in the time of surgery. 14 days. That was because of
Yeah.
the corona situation in North India is so bad that they cannot take any patient who has this kind of an injury. The oxygen requirement, it was nothing was available over there, and so they just flatly refused to operate this patient over there.
So this bike was just so the guy in the yellow, right, is the patient, I guess, that you're talking
Yes,
about.
yes,
And
yes,
they are just standing there with the bike,
yeah,
and I'll play it again how the car would come and just flung this guy off. See, in
yep.
nowhere.
Just vanished in thin air.
Yeah.
Yeah.
Very bad accident. Very bad
Very,
accident.
very bad. The parents are so hopeful that you do something. We have explained to them very clearly that we don't know the chance of improvement and the chance of recovery and everything, but they are just saying that I know my son was admitted for a surgery, and
Hmm.
then he was sent home because he was COVID positive. I want the surgery to be done, and with whatever they are very, very understanding and believers in God, like all of us are, and let's see, let's be hopeful.
And you were successfully able to operate on this particular patient, right? And
Yes.
you are saying he is doing well now
Yes,
at the
absolutely,
moment,
absolutely.
and
So
even
me,
in
my
the middle of
team, Doctor,
COVID. Hmm.
yeah. So I was in the surgery. Doctor Apurva Prasad, Doctor Suchita was the anesthetist. I had a team of 10 people in the COVID OT who were taking care of him, and I would like to thank all of them for their sacrifice and the risk that they have taken along with me for the surgery.
Very good. Very good. Well done job, Sumit.
Thank you, sir. Thank you so much.
And
Thank you
now
so
we
much.
are up with the time. So I
Yes.
think we'll end our program. And thank you very much, Sumit. And we'll take your help for the further program we are doing
Absolutely, sir.
on this with the Mirchita on
Yes.
Radio Mirchi. So please be in touch with us, and
Yes, sir.
hopefully we are able to reach more and more patients and upgraded with them with a good knowledge of spine surgery. That is our aim in
And
Corona
Sure, sure.
period.
And also one last question for both of you before we go to the next day's agenda is, any advice you want to tell to your patients or anything you want to share specifically related to spine surgery or spine problems for people who have COVID at the moment, because we didn't
Sumit,
discuss
tell your
about
opinion
precautions.
about our Jayesh. Jayesh bhai, you know Jayesh bhai. Yeah, he's the person.
I
So
know, Jay Bhai, sir.
tell
So
him
I
what
feel
is.
that if he is improving with medicines, don't do anything. But if you are just trying to suppress your symptoms by taking more and more medicines, medicines are not working for you. As soon as the effect of medicine is gone, you are again having pain. If it is affecting your day to day living activities,
Hmm.
if it is affecting your work, then you should get operated. The what you're suffering right now and what you will be suffering afterwards is there's no comparison. You will be thinking, I'm very sure, a rightly done procedure, you will think, why I didn't do this before. That's my opinion.
Yes,
Regarding
very
the
good, very
corona
nice.
COVID patients who are suffering with spine problem,
Yes, please something.
this is not a mobile virus. We are available on video consultations. We can do everything for you. We have solutions. We have backups. We have modified our protocols for to suit you. Not necessarily that we'll operate you right now if you don't need it, but if you need surgery, we are there. We operate every single kind of patient at almost all hospitals in Mumbai. We are operating COVID patients, non-COVID patients, and there is a very proper segregation between the two. So even if you have COVID and you have a spine problem, please feel free to seek video consultation very, very freely.
And also, can you share your number or any details? Just share the
Please
link with
share your
me.
number
Yeah, please. I'll post
Sure,
it.
sure,
so
sure.
that
Yes.
Yes.
You
I'll
can
share my
just,
card details over there. Yeah, quickly I'll send my card details, which you
yeah,
can.
you can send it to me so I can just quickly share it with our audience, right? So it's live the
Sure.
show. People can just get that information.
Yeah, I've shared with you.
Yes, I think I got it. Yes, so I will be sharing this, listeners, live with you all. Um, and let me talk about it. So it's 9819080700, and this is Dr. Sumeet G. Pawar, consultant neurosurgeon, endoscopic spine surgeon. The number is 9819080700. So I'll post this as well, and you guys can connect with him and take the opinion. And thank you so much, doctors. But before we leave, just last couple of thanks to, first of all, thank you for your time, and I'll invite Dr. Prakash Modha to tell us what is tomorrow's agenda, because listeners will be waiting for us.
yeah, yeah. Tomorrow also a lady neurosurgeon from Mumbai,
Okay.
our Sumit uh, Shraddha Maheshwari, she will be talking about COVID and vaccines and advantage, when to take vaccine, what to do.
Okay.
She will tell us all the things in detail. So tomorrow, Dr. Shraddha Maheshwari, the only female neurosurgeon of Mumbai. No, second. She is the second
Second
neurosurgeon.
neurosurgeon.
Abhida is there, and this. Sumit, is there anybody else
Um, Dr.
in
Sumit,
Mumbai?
we can't hear you. Can you unmute yourself?
Sorry,
Yeah.
very, very, very few female neurosurgeons.
Yeah. So
Can you
she
tell
was
her name
also
again? What is her
Shraddha
name?
Maheshwari.
Dr.
It is
Shraddha Maheshwari. Okay.
Shraddha, Dr. Shraddha Maheshwari. So she'll be talking to us tomorrow.
So we can tell our audience that whoever is watching us live, please ask us questions. You can send us before also, so we'll ask
Yeah,
those
yeah, yeah.
questions.
She is
Right.
a very good neurosurgeon,
Mm-hmm.
particularly for upper cervical spine, and she does lots of surgery with anterior approach for the upper cervical spine, like mainly C1, C2. And her her guru is my friend Dr. Sushil Patkar, who is in Pune, and we'll bring him if he agrees also one day, because he's a lively man, very nice man,
You will have a lot of
and
fun in
we
the
love
show.
him. We
So,
love him.
our intent is right, Dr. Modha. My intent is, let's bring each and every doctor in the world on this show at least for 30 minutes and keep going. We don't want to
Yeah,
end
yeah,
this,
we
right?
will keep going, and we'll request and ask Sumit also, get the best person, if
Yeah.
you know, worth
Invite
bringing
us.
over in our program, who's matching with our wavelength.
Yeah.
Should be, we allow everybody. There is
Yes.
no segregation, there is no group. If Sumit is getting benefits, Sumit should get it. That is what I believe.
Yes.
And that
Thank you
is
so much,
why
sir.
it's our duty to promote our boys.
Yes.
You see,
Of course.
so that's why I think we should bring more and more knowledgeable, very good neurosurgeons in this
Celeb
program.
doctors.
Yeah, doctors, not all neurosurgeons. And actually,
Yes.
I was thinking
Mm-hmm.
of bringing one lady who is a doctor, but physiotherapy doctor, and she makes lots of activities in Mumbai
Uh-huh.
during this COVID time.
Excellent.
So actually, she's not any surgeon, but a physiotherapist. And if she agrees, I have not talked to her so far. If she agrees, I
Sure.
will bring her.
So, Dr. Modha, let's end the show right now because I know doctors have to go, and listeners, I will not take a lot of time. But always, the intent is that we'll always bring new doctors and new items and new agendas that we will discuss. So please keep watching. This is the world's only first and ever COVID awareness show that we have started live. So if you want to suggest, give reference of any other doctors, most welcome. Thank
We'll
you.
scrutinize and we'll include them.
Yes,
Okay.
definite. Thank you
Thank you,
all.
Sumit.
Thank you
Good
so much.
time.
Thank you so much for having me over.